Yes, now a very warm welcome to today's talk. It's Emmanuel here. I'm a medical clinician in my refugee hosting community in northern Uganda, that is Africa. For those who are so new to this channel, I've dedicated myself to speaking about the health issues affecting most of the whole world at large, but it more so affects so much the marginalized communities in Africa, also other poorly developed countries, the rural communities, because you find the biggest contributors to the health challenges in Africa. One is poverty. The high levels of economic disadvantages has become a very big contributor to the health crisis in this community. Secondly, also ignorance amongst the poor people, because they don't have access to these informations. And I know this happens to every part of the world, but I've dedicated this channel to more so moving the African communities, my refugee hosting community, teaching preventive medicine and talking about the current prevailing health issues in the world, so that they get to know and they get so much information about it, and they take a chance of taking care of their health individually and as a family. I also move communities providing medical care to the sick children suffering from preventable illnesses like malaria, which has been a very big death threat among us children, more so children under 5 years of old. So it has been a very long journey in this channel, almost a year. This is now December, and we have really moved progressively with over 250 plus subscribers. We have started from a scratch, but if you're so new to this channel, I pray you consider subscribing to this channel, commenting and sharing about the health issues and how things are done in your communities. And we get to share different knowledges which we'll use to build up a very scientific approach to managing some of the different conditions that we have in our different places. And this channel has been standing because of support from kind people who really love to share their blessings with us, to run our community work, moving the different communities, to help the sick children buy some few essential drugs at a very low cost. But we find these families could not afford these drugs. Now I want to bring to your attention about our upcoming medical camp, whereby we shall be focusing so much on children, treating some few skin diseases which has been a very big threat in these communities, and worm infections and so much others diseases like malaria, providing mosquito nets at a cost which we can sustain, and also helping to talk to these children about how to effortlessly prevent some of the common non-communicable diseases, because you find there have been a recent report that there has been a global surge in type 2 diabetes among us children and adolescents, which have been so much contributed by the childhood obesity as a result of what we eat more so. So it's very important to talk to these children at a very young age, so that they grow at a very known place and they actually take charge of their health at a very young age. Because you find that situations in the developing countries, the rural communities, we cannot really handle all the issues using some of the public health policies, like spending so much money on drugs and buying, but so much money should be spent on more preventive medicine, so that we try to arrest these issues so much fast, other than waiting for many other issues to rise and we find ways of curing diseases. But prevention is always better. That's why I move these communities, and it's through your support that it's possible, because it's a very big scattered community, meaning we have to move to the different places, talk to these children, talk to the elderly, talk to the different families, and providing to them the necessary essential medical care which we can actually sustain at our level. So for those of you who have subscribed and been supporting us, we really thank you so much for your effort as the year closes. May God bless you, and we have a very abundance of providence from God. Now, that's not what we are coming to talk about. I want us to talk about a very brief topic which is more so affecting some developing parts of Africa, that is more so in the Democratic Republic of Congo. There has been so much report about the mysterious flu-like disease, which we call it the disease X, which has really so much impacted the health issues. And in the recent government report, over 100 plus people have died, and more so children are more so affected, children below 5 years. So I've seen countries making so much public health policies and restriction. I've seen Hong Kong, China, and also so many different countries in the Western world. I've gotten reports from Italy. They have made a lot of restriction, but I'm asking myself why in the different parts of the Africa, most of the countries bordering Democratic Republic of Congo, why they don't make these restrictions to avoid this future pandemic, which is really so much important. Though there are more research taking place to identify the diagnostic criteria and more details about the symptoms and how the mode of transmission of this disease X is, but we need to put a lot of research and talk about this thing, and also make it effort to see how these things are done. So we shall be bringing more reports about this, and if you find this very important, you will consider to follow us some more, and we find one of the best remedies to fighting all these future pandemics, and also putting the best scientific approach to all these issues, so that we get as a world to collectively avoid so many future pandemics, which is a very big threat, we know, to the economies of the world and everywhere. So thanks so much. We wait for the next video where I'll be bringing more reports about this from the source. So you're most welcome. If you're new to this channel, consider subscribing and commenting, sharing, and growing together to see how we can improve everything. Thanks so much.